Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Welcome to GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Cynthia, and happy Tuesday, everybody. I hope you are all hanging in there. I know it's a really crazy time we're living in right now. To be honest, I don't even know how I wanted to start today's episode. I just a few hours ago found out that, as most of you know, I work at a gym, and the gym is now temporarily closed due to coronavirus, which, again, I'm like, it's bittersweet for me because, one, it's a very smart decision, right? Because we want to lessen our exposure to the virus, and we heighten the exposure when we're around lots of people, and the gym is a prominent area for lots of people to gather and germs to be transmitted everywhere. It's germ infested. So it's a smart decision, smart move from the owner. So I'm not mad about that. But the stressful part of this whole situation, as many other Americans are also facing right now, not just I, but now we're unemployed for the moment. And the uncertainty is what is killing everybody, including me, because we don't know how long this situation is going to last. It could be weeks. It could be months. We don't know. So we just all got to hang in there and support each other and take it day by day, because I just found out also earlier today that this whole epidemic can last until as early as July or August, which I can't even fathom the idea of being quarantined for that long. I was thinking the situation would hopefully die down, starting in hopefully in April, end of April. But by the looks of it, health experts are saying, nope. If people start doing what they're supposed to do starting now, meaning wash your hands, stay clean, disinfect everything you touch, isolate yourself from the public, try to avoid large crowds, meaning not gathering in unnecessary scenarios like the bar, club, gyms. So it's a really weird situation we're all facing. We're literally living in history. This time that we're all going through together is going to go down in the history books. And it's wild. I mean, even my 80-year-old grandma, she states that in all her 80 years, she has never, ever came across anything like this in her life, as none of us have. So it's just really wild. And that's why I said it's been such a somber mood day as well. Here in Northern California, Sacramento area, it's also been raining, which I know if you're listening to me in whatever part of the country you live in where there is rain, you're probably like, girl, what are you talking about? But here in Northern California, it has not rained at all in the entire month of February, even end of January. And now this whole coronavirus has spiked. And at the same time as that spiked, it has been raining for the last 3 days here nonstop. And it's going to continue to rain. So it's just us Californians, we complain about when it's not 75 degrees and shiny outside or sunny. We don't like that. So it's rainy and it's just a lot going on right now. Okay. So like I said, we're all in this together. We're all going through it, and we just gotta, check our mental health most importantly, because I know a lot of our financial situations are going down the drain at the moment due to the virus. It is affecting us at every level in every industry. I'm here with you though, so we're all, like I said, we're all in this. And I know like the last couple of episodes we've talked about coronavirus, which, that's all in the news. That's all they're playing right now. So it's like how it's hard not to talk about anything else, because I feel like that's where we're all focusing our energy at the moment, is just like, what's the latest coronavirus update? Who's been infected? What are the new precautions we must take? So it's normal. Like, I understand why coronavirus is the only thing we're able to talk about. This is like a worldwide health situation. So it makes sense that this is all we're able to focus on. So that's why I'm here talking about Mythbusters of coronavirus. Hopefully I'm able to debunk some of the false claims out there of coronavirus. I've heard some very wild claims, and it's hard to know what to believe, what not to believe. There's so much information out there being thrown at us all at once from the media, from your favorite fitness influencer, which, by the way, do not take advice from like a fitness influencer, including myself. However, all the information that I'll be sharing with you guys here today, I pulled from the World Health Organization. So all of this information is 100% accurate. So you can feel comfortable when listening to me today in today's episode. Feel confident that all the information that I am providing you is valuable and accurate, most importantly. So let's get into it. Let's debunk some of these myths surrounding the virus. First one, coronavirus can be transmitted in areas with hot and humid climates. From the evidence so far, the virus can be transmitted in all areas, including areas with hot and humid weather. So regardless of the climate, we should all adopt, protective measures if you live in or travel to an area reporting, lots of cases of coronavirus. And, the best way to protect yourself against the virus is by frequently cleaning your hands, washing them with soap. And, by doing this, you eliminate viruses that may be on your hands and avoid infection that could occur by then touching your eyes, mouth, and nose. So, again, coronavirus can be transmitted in areas with hot and humid climates, not just wet and cold. Next Mythbuster here. Cold weather and snow cannot kill the new virus. So I've been, reading on Twitter, people are saying, constantly keep your throat wet, lubricated, because coronavirus can't thrive in wet areas. So I think that's why this whole myth began of, coronavirus can't thrive in cold areas, wet areas. However, according to the World Health Organization, cold weather and snow cannot kill the virus. So there are many reports that state that there's no reason to believe that cold weather can kill the new virus or other diseases. The normal human body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, regardless of the external temperature or weather. So our internal environment stays the same regardless of what's going on in our external environment. And again, I'm reiterating, the most important and effective way to protect yourself against the coronavirus is by frequently cleaning, washing your hands with alcohol-based hand rub or washing them with soap and water, okay? Hand sanitizer can only get you so far. Hand sanitizer is great when you are in a predicament where you can't go to a sink and wash your hands. So say you're in the car and you need to, cleanse a little bit of the bacteria off your hands. Hand sanitizer would be, would do the job in that specific time. But majority of the time you want to make sure that you are washing your hands with soap and water. Next. Taking a hot bath does not prevent you from the coronavirus disease. I've also been reading this all over Twitter, which again, I should not be getting most of my information off Twitter, but that's like my daily newspaper, you feel me? So that's where I'm like reading all of the latest coronavirus updates. So again, taking a hot bath does not prevent you from the new coronavirus disease. Our normal body temperature remains around, again, I'm reiterating, 36.5 degrees Celsius to 37 degrees Celsius, regardless of the temperature of your bath or shower. And actually, taking a hot bath with extremely hot water can be harmful as well, can burn you. And I know this is an issue for us ladies to wrap our minds around because we like to burn our skin, like myself included. I'm guilty. I love taking hot showers. So ladies, try to avoid this. It's not good for your skin. And it can be harmful in the long run. And I'm going to cut into our first quick break here. When we come back, I'm going to share with you guys more Mythbusters of coronavirus.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Hey guys, and welcome back to GSMC Health and Wellness Podcast. And let's get straight into what I was just talking about. Again, we're debunking some myths surrounding the topic of the coronavirus, the craze of the coronavirus. Here's another one. The new coronavirus cannot be transmitted through mosquito bites. I understand why people would believe, this could happen because we have heard in the past that mosquitoes, travel. What was that one? I don't know if it's SARS. I'm not sure. But back then there was something that mosquitoes were carrying around and, was getting people sick. So I can understand why people would assume this would apply for the coronavirus. And just a disclaimer, none of these myths or, assumptions the public has, none of these are dumb or we can't think why would anyone think this? This is so new to us. So anything, in our surrounding this is possible. So everything that I'm mentioning, I don't want anybody to get offended. If you thought this and I'm saying that's not true, don't feel ashamed of yourself for not knowing or dumb. Trust me, I didn't know any of these facts prior to me researching it. So just wanted to put that out there. So again, the new coronavirus cannot be transmitted through mosquito bites. To date, there has been no information or evidence to suggest that the new virus could be transmitted by mosquitoes. The virus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. So this is very important that when you cough and when you sneeze and cough into your elbow, not into your hands or into the air. That is literally my biggest pet peeve prior to even this whole coronavirus craze happening. I have been taught this since I was in kindergarten. So since kinder, I've had the good habit of sneezing and coughing into my elbow. And when I see people around me who don't do it, who just sneeze out to the side or onto their hands, that is my biggest pet peeve actually. I will get pissed and I will call you out and be dude, that's gross, Cause just think of like some people are like, oh, well, I'll wash my hands immediately. But it's like, no, half the time you can't predict when a sneeze is going to come up. If you're in the car and you sneeze into the air, all of those particles are into the air. So we all inhale it. Like that is disgusting. So especially with, the high rate, how fast the virus is spreading, we have to be cautious. We have to be considerate of the people around us and sneeze and cough into your elbow. Okay. Next, are hand dryers effective in killing the virus? Another good, myth here to debunk. And the answer is no. Hand dryers are not effective in killing the coronavirus. Once your hands are clean, you should dry them thoroughly by using paper towels or a warm air dryer. But just like, sticking your hand in like an air dryer is not going to like kill the virus or kill the bacteria on your hands. Next, can an ultraviolet disinfection lamp kill the new coronavirus? And here's the answer according to the World Health Organization. UV lamps should not be used to sterilize hands or other areas of skin, as UV radiation can cause skin irritation. Makes sense. I mean, we are constantly in contact with radiation from our phones, computers, TVs, etc. So, exposing our skin to more radiation would probably not be the safest. So, again, can ultraviolet disinfection lamp kill the new coronavirus? Answer is no. How effective are thermal scanners in detecting people infected with coronavirus? And the answer is thermal scanners are effective in detecting people who have developed a fever because of infection with the new coronavirus. However, the thermal scanners, they cannot detect people who are infected but are not yet sick with fever. And this is because, again, it's been told to us that symptoms don't hit till possibly like weeks later. So it can take anywhere between 2 and 10 days before people who are infected become sick and develop a fever. So that's why it's like you can't detect, thermal scanners can't detect who's infected with the virus. It can only detect when a fever has developed. Does that make sense? Yes, no, maybe so. All right, here we go. Next. Can spraying alcohol or chlorine all over your body kill the new virus? So like, does spraying Lysol all over your clothes help? And the answer is no, which I've seen so many people do this too. And again, it makes sense. Like, and I'm not judging anybody for the way they're trying to take precautions. Everyone's spooked during this time. Again, this is something new. None of us have experienced anything like this before. So none of these questions are dumb. But the answer is no. Spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. Again, they enter your body through mouth, nose, ears, touch, all of that. Spraying such substances can be harmful to clothes or like your eyes or mouth. So be aware that both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. So you also don't want to just be spraying like an entire bottle in one sitting, because you do inhale those particles of the disinfectant spray, and it's not good for your lungs either to just constantly, sniff that. So use it wisely, especially with the shortage of cleaning supplies and toilet paper right now, because people are hoarding right now. Just be mindful of how you use your products. Don't be wasteful. Next, do vaccines against pneumonia protect you against the new virus? And the answer is no. Vaccines against pneumonia, such as the influenza type B vaccine, do not provide protection against the coronavirus. The virus is very new and different, and it needs its own vaccine, which, from my understanding, for whatever I've been reading, trying to keep up to date, I think a couple of countries have, correct me if I'm wrong in the comments, I heard that Canada might have developed a vaccine for the virus. I could be totally wrong. If you're from Canada listening to this podcast, please let me know, because I would love to know that. So researchers are trying to develop a vaccine against the virus, and, the World Health Organization and the CDC are supporting their efforts. Among these vaccines, although these vaccines are not effective against the coronavirus, vaccination against respiratory illnesses is highly recommended to protect your health. So regardless, do what you can to just protect yourself, protect your immune system, protect your lungs, all of that stuff, especially during this critical time we are all living in. Next, can regularly rinsing your nose with saline help prevent infection with the new virus? And the answer is no. There is no evidence that regularly rinsing the nose with saline has protected people from infection with the new virus. There is some limited evidence that regularly rinsing your nose with saline can help people recover more quickly from the common cold. So again, I understand why people are asking that question. Like, if we, regularly rinse our nose with saline to recover from the cold, can't we do the same with the virus? But again, the common cold and the virus are two separate things. So it hasn't been shown to prevent respiratory infections. Again, it's just that's what's almost like the frustrating part. And this isn't to put blame on anybody, because this is nobody's fault right now. It's just really hard to, again, how do we kind of depict if you have a cold versus a virus, the coronavirus, or if you have allergies versus the virus? Like, it's very hard because, again, some people don't show symptoms. Some people show symptoms, but again, they're like allergy symptoms, or you don't show symptoms till a couple weeks later. And it's like you're walking around for those 2 weeks, infecting others and touching things and visiting places. So it's hard because, scientists and medical professionals are working day in and day out to kind of solve, this epidemic we're facing. And there's just very little information out there. All of this is so new to us. So we can't be mad at anybody. All we can do is just, stay calm, stay positive, do our part, take the necessary precautions, get informed, get educated, make sure that the information you are, getting all your coronavirus information from are from reliable sources such as the CDC or the World Health Organization. And I'm going to cut into another quick break here. When we come back, I'm going to share with you guys more Mythbusters of coronavirus.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Welcome back to GSMC Health and Wellness Podcast. And here I am sharing more information with you guys, more credible information of, pretty much the coronavirus. Now, this next question that we're about to debunk, figure out, was very interesting to me because I've never heard of this. And it involves garlic. The only use, I love garlic. I like to put it in all my foods, in my seasoning. And I heard, and I've tried this, and I can testify that garlic is great for helping growing your nails extremely fast. Kind of sidetracking here really quick. I went to a dance class heels dance class, by the way. So, long story short, a girl kicked me at my hand, broke my nail off, and I know it's gross, just like the imagery of it all. It hurts, and it was very painful. And my mom suggested to me to rub garlic, like a real garlic clove on my nail to help grow it back. And literally, you guys, within 2 weeks, my nail was back even healthier and even longer and more sturdier with the help of garlic. So as far as I'm concerned, that's the only like thing I've heard how helpful garlic can be with our health. So all of that to say is for my question here, can eating garlic help prevent infection with the new coronavirus? I've never heard of this. Have you guys? Let me know. So garlic is a healthy food that may have some, antimicrobial properties. However, there's no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. Who knows? Maybe in these next couple months, we're going to find out. If you love garlic, maybe you can test it out. Next, are antibiotics effective in treating and preventing the virus? I think this is an awesome question. And the answer, according to the World Health Organization, is no. Antibiotics do not work against viruses, only bacteria. The new virus is, a virus. Therefore, antibiotics should not be used as a means of prevention or treatment because antibiotics are used for bacteria. So they do suggest, however, if you are hospitalized for coronavirus, you may receive antibiotics because bacterial co-infection is possible. So it's only if you, get hospitalized. Next, I think this is a very imperative question. I need you all to listen up. If you're going to listen to any of these questions, any of these myths I'm debunking, I think this is the one you need to listen up to because there's been a lot of mixed reviews, a lot of mixed opinions, but this is according to the World Health Organization and the CDC. So this is very important for you all to listen to. Should I wear a mask to protect myself? Here's what they say. Only wear a mask if you are ill with coronavirus symptoms, especially coughing, or looking after someone who may have coronavirus symptoms. So if you live with elderly people, you should wear a mask. If you live with somebody with pre-existing medical conditions or respiratory illness, you need to wear a mask. If you are a healthy millennial just going to the grocery store, you do not need to wear a mask, okay? If anything, health professionals are saying you're doing more damage that way because you're like breathing in your own bacteria. So it's really going to harm you in the long run. Disposable face masks can only be used once. So if you're like continuously, repeatedly using the same mask, you're not doing yourself any good. So there is a worldwide shortage of masks. So the World Health Organization urges people to use masks wisely. Again, don't be wasteful. And they also advise rational use of medical masks to avoid unnecessary wastage of precious resources and misuse of masks. And again, medical masks, those you have to like get measured for your face. So, and you can only get those in medical environments. But again, World Health Organization, they're just urging people, don't use it if you really don't need it because we are on a shortage. And shout out to the billionaire out in China because he is donating the U.S., I think 1 million masks. But again, use them wisely. Only use them if you already have current symptoms or if you were taking care of elderly or just anybody who may already be exhibiting those symptoms. Next, there's also a really good question, I think. Can I catch coronavirus from my pet? This was actually a concern of mine. I'm not going to front. I have a very cute husky mix dog, and I was nervous that I was either going to transfer the virus to him or that he could transfer the virus to me. And thankfully, the answer is that while there has been one instance of a dog being infected in Hong Kong, to date, so far, there is no evidence that a dog, cat, or any pet can transmit coronavirus. This is like music to my ears. Finally, like something good. You know, I gotta look at the glass half full here instead of half empty. So dogs cannot transfer coronavirus to humans. It's mainly spread through droplets produced when an infected person coughs, sneezes, or speaks. So that's awesome news to hear that we can't be infected by our pets. And the World Health Organization continues to monitor the latest research on this and other coronavirus topics and will update as new findings are available. So again, just keep checking on their website. I've been doing that. And again, all of this information I'm providing you guys, it's on their website. So credible information. I would take it from them. I would listen to them. All right. Next, how long does the virus survive on surfaces? Another really important question. And I quote from the World Health Organization website. It is not certain how long the virus that causes coronavirus survives on surfaces, but it seems to behave like other coronaviruses. Studies suggest that coronaviruses may persist on surfaces for a few hours or up to several days. This may vary under different conditions, such as type of surface, temperature, or humidity of the environment. So again, all in all, more studies need to be conducted, and they can't give an exact number of like, it lasts for 3 to 4 hours. Like, we don't know. Just clean. My rule of thumb is clean and between each person touches something. If you touch a corner of the table and, Lysol it before the next person touches it. Or like if you touch a door handle, a doorknob, Lysol that, wipe it before the next person touches it. That's just being cautious. And if you think a surface may be infected, again, just clean it with simple disinfectant to kill the virus and protect yourself and others. We're almost done debunking these myths, you guys. I hope these have been helpful for you. Next, is it safe to receive a package from any area where coronavirus has been reported? This was a huge concern of mine, especially for my ladies out there who are shopping fast fashion from Fashion Nova, Pretty Little Thing, Dollskill. I don't know. There's like so many fast fashion companies out there now. Most of these companies are being shipped or, clothes are being made from China, other parts of the world where there are very high reports of, these cases. And I was actually surprised by this answer because I would assume it's in a facility where a lot of people are in, a lot of physical contact is being made. And that package could possibly bring the virus to me. And according to the World Health Organization, they state, yes, it is safe to receive a package from any area where coronavirus has been reported. That the likelihood of an infected person contaminating commercial goods is low, and the risk of catching the virus that causes coronavirus from a package that has been moved, traveled, and exposed to different conditions and temperature is also low. This was very surprising for me to hear again because I would assume the worst, and I would assume you can get contaminated from packages, but they state no. So that's great to hear. So continue your online shopping. Don't be afraid. Go order from Fashion Nova, all right? Or just from wherever. Most products in general are made from or outside the U.S. anyway. Final question here. This isn't really a myth, just some info I want to throw in there. Is there anything I should not do? Absolutely. You should not smoke during this time. You should not wear multiple masks. Again, that's going back to, should I even wear a mask? If you are wearing a mask, you shouldn't wear multiple masks. You should wear a medical mask that's measured to your face. And you should not take antibiotics. Again, that could be harmful. Antibiotics are for bacteria, not for viruses. And last but not least is one of the most important ones. You should not hang around large groups of people, especially in close proximity with each other. They are really pushing, the CDC and the World Health Organization are really pushing for social distancing. What is this? Social distancing is pretty much distancing yourself from others unless it's absolutely necessary, like going to the grocery store or, the pharmacy or whatever. So right now is a really critical time. Do not meet up with your friends at restaurants. Do not meet up with your friends at the gym. Do not meet up with your friends at clubs or bars or pubs. Wherever the case, where it's not necessary, they're saying isolate yourself, because one person can carry symptoms and not know it and contaminate 10 other people, and then that domino effect keeps going. So it's like really important to social distance yourself, so we can decrease the extremely fast-paced spread of this virus. And health experts and scientists are saying that if we do this now, we'll be able to slow down the curve so that we are able to stop the spread of this virus as quickly as possible. And ladies and gentlemen, that's going to wrap up today's conversation here at the GSMC Health and Wellness Podcast. I know this was a lot of information, but I hope you all listened to this episode all the way through, because I believe all of this information was very vital, useful, valuable. I think I debunked a lot of myths out there. Again, there's tons of information out there. We're getting it left and right. Who's a credible source? And you guys, I'm telling you, everything I stated in today's episode is from the CDC. It's from the World Health Organization. So be confident that everything that I'm expressing in today's episode is credible. And I want to just wish you guys a very healthy, happy week. Keep your heads up high. I'm trying to as well. I know it's easier said than done. We're all going through this. We're all experiencing the effect of the virus. Let me know in the comments how many times I said virus and coronavirus. I know I said it like 100 times in today's episode. And yeah, just stay safe, you guys. Stay clean. Wash your hands with soap and water. Social distance yourself. And just stay up to date. But don't consume your entire life on just those updates, because those can be very stressful. So just, a little at a time, but still take the proper precautions to do your part. Do your due diligence in trying to stop the spread of the virus. And don't forget to like, share, and subscribe. And I just always thank you so much for tuning in to today's episode. And I'll catch you guys here next week.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.